Hi, I'm Debbie Watson. I'm a clinical care pathway coordinator. I've been working with Dr. Feldman and Dr. Carley since 2008 on creating, implementing care pathways. So today I'm talking to you about the role of the nurse. I have no disclosure. I'll share with you some of my tasks, some of my responsibilities. I'll describe the role of the nurse before, during, and after the implementation of an enhanced care recovery care pathway. And I'll identify some strategies in the implementation and, very important, the buy-in of the frontline staff, the nurses. When we start a new care pathway, I usually ask our librarian to help me to do a quick lit search, and then I read a couple of articles, and then you have to have somebody that writes the first draft, right? So you write the first draft of the orders, the medical and the medication orders, and that usually, it creates good conversations. At least you can talk about it. So if you don't have anything on paper, there's not much to discuss, right? Then I usually meet with a lead surgeon. Dr. Ferry is one of the lead surgeons that I've worked on when we did care pathways for thoracics. So I go through my drafts and I review and modify the orders. And then I bring the lead surgeon along with my team. And then we review line per line all the orders. We get consensus, hopefully. I think consensus is important because if we don't get consensus, afterwards it could be problematic for the nurses on the floor when there are surgeons that are following and then one or two of them are scratching out everything that we've written. We don't have electronic medical record yet, so that could be problematic, and that's why we like to reach consensus. I think sharing the orders before it gets to the final draft is very important because you might have forgotten something in your process, so get feedback. As I said, we don't have electronic medical records, so I do have to write the nursing documentation. I do write standards of care for every day of the care pathway. I modify before I send off to the approval committees. Once it's sent to the approval committees, I start to work on patient education. And I feel very strongly about patient education. I think it's as important as the medical or the medication orders, and no care pathways are launched without our patient education material. This is an example of our pictogram. It's our bowel surgery, and we have them all for each care pathway, and we also have a booklet. I can't stress enough the importance of communication with the frontline nurses. They are the ones that patients spend more time with during the hospitalization. So I think nurses need to know about ERAS. They need to know about the elements of ERAS. They need to know what is a care pathway before anything comes their way. Then you set a launch date. You keep your fingers crossed, and then you start. I stop there, but afterwards I'll elaborate a little bit. It's not the end of it. So going back a bit about the planning, I think the planning phase is the most important phase of the whole implementation. So you have to know your processes. Hopefully you can collect data. Data is very, very important, I think, because if you can collect data before and you launch and then you have data after, it has an impact. The nurses are going to react to this. You'll be able to show them the difference. Communicate to frontline staff from the start. As I said, don't wait until all the paperwork is done to go on their floor and to show them what they're going to do. I don't think that's the right start. I think that you need to meet with them, very general, what's happening, what's your team, what is it as, and then go back and then show them what you've done. Schedule regular team meetings. And I remember when we started in 2008, Dr. Feldman came to me the first meeting and she says, Debbie, you're going to send a reminder every week to the team. And I said, oh, okay. But looking back at that, well, she was creating a sense of urgency. And I think it's very important. So it also now, I've been doing it since 2008, every Wednesday, that reminder goes out to all my team members and I tell them about what's gonna happen on the Friday meeting. So it helps the momentum as well. So before you write the drafts of the care pathway, you present them, you get consensus. The one thing that I don't like about my job is the approval committees. I think they're very bureaucratic and they're long and it takes over 1 year before all my pathways go through. But there needs to have someone to shepherd these documents. At one point, if you have 4 care pathways at different stages, you need to know where they are and what are the changes that need to be done. Create patient education material. I think it's important to include image to make it interesting for our patients. Write in plain language. Very difficult to do writing in plain language. We have a tendency just to put on too much details in our patient education material. Keep your grade has to be to grade 6. Your literacy level has to be to grade 6. Keep within the health literacy standards, and there's a lot out there regarding this. Set and communicate the launch date. When I say tailor introduction to the situation, I mean that sometimes on a ward, there's a lot of things happening, and you don't want to launch a care pathway when there's already a lot of things happening. It's not a good way to introduce it. So I always, when's a good time for you? When would be a good month or week? And then we do it. And always educate staff very close to your launch so it's fresh in their memory. So you implement, and during, the nurse remains as a resource person, continues to collect data. You can evaluate your patient education material. I do, and I modify them also. The images, if they're not meaningful, you have to go back to the drawing board and change it. I started to do this recently. I do some spot checking. So I go back on the ward and I make sure that we're all using it. And if we're not, how come? Did I miss something in the process? Sustainability is the last phase. I find that I wanted to have a definition of sustainability, and I found it this year. Sustainability is achieved when a process or outcome at a minimum of 1 year later has not returned to its former status. So I guess you can relax after 1 year. So during that year, I remain a resource person. I organize meetings with all stakeholders. You have to know what works well, what are the challenges, so you need to change them. Also, I organize quarterly meetings with the frontline staff to share the data with them. And you need to improve on your data. And I think the strongest thing you can do to improve on your data is to ask staff feedback. Get them to participate in it. Visual cues also help in sustainability. The pictogram that you saw became huge posters on the wall so that there are reminders for nurses and there are reminders for the patients also walking in the hallway. So strategies for success, well, unfortunately, there's efficient and generalized strategies to change organization culture in healthcare have not been identified, and the best strategies for implementing pathways in hospital settings remain unknown. So I guess I can give you some cues, and that's what I'm going to do, but you'll have to go back and adapt it to your organization. 70% of change projects fail because of the failure to engage staff at all levels before, during, and after a change, and or to embed the new processes into everyday practices. So how we get the buy-in from frontline nursing staff? Well, I think communication, as I mentioned before any change comes their way. Involve them from the start, ask their opinion, get their feedback. Participation might lead to less resistance, but let's face it, you're going to have resistance. Change does not come with any resistance. Adapt the evidence to your local setting. Create a vision and share this vision. And invite them to your team meetings. The good thing about having a care pathway is that there's no more exceptions to remember between surgeons. Before this job, I used to work in the pre-op clinic, and I had to remember that this doctor liked this bowel prep, and this doctor didn't want any bowel prep, and that this one, well, wanted another type of bowel prep. So that is very good for nurses. So everybody's the same. It increases consistency throughout the orders, the protocols. The workload issue, there's a rapid turnover of patients, but patients are more independent. They have less tubes, there's less drain, and tubes and drains are like restraint to patients, right? So if they don't have any, they're going to be more independent. They're going to get out of bed. They're going to walk. Also, less opioids to be given if you have an epidural in. There's going to have to be more teamwork, especially regarding mobilization. Before we had the ERAS database, we didn't have a pretty good way of getting data in, so I asked my husband to create an Excel spreadsheet, and he did. And we went to the store, and we got these big wood, they're not wooden, but they're very sturdy, and double-sided tape and notebooks, and we created these posters, and every month I'd go and put in fresh data so that the staff would see the data. They would see the impact. So share your data and give back the information to the staff. And then we got the ERAS database, so it doesn't collect only the outcomes, but the processes. And when I said before, I meet quarterly with the staff, this is what I present with them. These are the 22 elements that shows when we're compliant and non-compliant. So this is the pre-op. As you can see, everybody gets pre-op patient education, and then intra-op, and then post-op. So I present that to the staff. This is one way also of presenting it, and it's a trend. There's another way. The next one I'm going to show you is on my wish list, and it's on my to-do list for this year. I think that frontline nurses might struggle to recognize individual patient impact from clinical performance data when it's accumulated like that across weeks or months. They can't relate to it, but instead, you put human icons on it. And by connecting performance data to the actual number, leaders can increase frontline nurse interest in the data and create individual investments in improving performance. This particular hospital in Tennessee really improved on their indicator rates. It was for UTI. These are just 9 words that I think describe very well what is a leader, and I think that passion is number 1, communication, knowledge, and having a vision, being creative. There's so much that a nurse can do being part of this team. Organizational change and characteristics of leadership effectiveness. Gilly and his colleagues looked at behaviors linked to leadership effectiveness and driving change. And they concluded that the ability to motivate, communicate, and build team were all predictors of successful implementation of organizational change. Distributed leadership. Cream and his colleagues confirm what I fundamentally believe in, is that not one single person has the ability, resource, or expertise to lead a change, but rather these characteristics are distributed across different individuals who combine their efforts to bring about change, and that this type of leadership is spread out vertically and horizontally across levels and is prevalent in healthcare organization. I'll finish my presentation by saying that the nurse plays an important role in the creation, the planning, the implementation, and the sustainability of the enhanced recovery care pathways. The hardest part is holding the change when enthusiasm may die and problems arise. Being successful demands careful attention during the beginning, middle, and end. Many scholars have attempted to define nursing. Some define it more as an art, and some say it's more of a science. I think that it's in this role, it's definitely both of each, an art and a science. There are several tasks and responsibilities in which the nurse is responsible for, and it's definitely an interesting role where challenges are soon forgotten once we see the patient's benefits. This type of organizational change requires the management support, and at the same time, a willingness to change is required. The quality of the care pathway can only improve if there is a systematic follow-up. You need teamwork, increased communication, and patience. Change takes time. Thank you.